This week's guest on the Cool Grandpa podcast is Renee Balcom. Now, Renee was on about 2 years ago, and she is a fantastic individual who's really helping people navigate the healthcare system. The way she's doing that is by using her expertise as a former tech CEO and, well, I guess a current tech CEO, as you'll find out, to help advocate for people in all sorts of healthcare situations, whether they're very young clients or elderly clients. Renee is going to talk to us about the importance of having a care plan put in place, how we as grandparents who might have elderly parents need to really be able to go in with a game plan when we're taking our moms and our dads in for consultations with their healthcare providers. You are going to enjoy this conversation, and be sure to go to the Cool Grandpa bookstore. Check out my book, My Grandpa's Grandpa, as well as all the cool items in that bookstore. I've got polo shirts and ball caps. I've got glasses and mugs. I've got mouse pads. I've got all sorts of different things to really celebrate you as a cool grandpa, or for you to purchase to celebrate the cool grandpa in your life. So be sure to check that out. And without further ado, let's jump into this conversation with Renee. Hi, Renee. Welcome back to the Cool Grandpa podcast. I'm excited to have you back on.
Hi, Greg. I'm so happy to be here. Thank you. I'm happy to have this time with you again. It's been a long time.
It has. As I said, I was listening to our podcast from almost exactly 2 years ago. And so this is going to be a great time for us to catch up with so many advancements, so many changes that have gone on in the last couple of years. Now, I want to jump in and start out by asking you, since our last time together, what has been something that's really jumped out over the last couple of years with you as a healthcare advocate about caregiving, aging, and the intergenerational family dynamics that we have?
I think I love this question. It's funny because we've been talking for at least a decade now about the aging population and around the world and what's going on with aging and with caregiving and medicine and just, all of the dynamics that's going on in the care spectrum, if you will. And what's interesting to me is how unprepared people are in servicing and caring for their loved one that's aging, right? And yet it's been a topic of conversation for a minimum of 10 years, right? And I think about it almost like the frog that's in the pot, right? The pot of water with the low boil, that's who we all are as family caregivers. We're that frog in the pot on the low boil. And we're pretending like it's not really happening. But eventually the heat turns up and we realize that we're cooked, right? And that's what's going on with caregiving and with the aging population right now, that so many family members are surprised and unprepared by their own aging, number one, or by the aging of their loved one. And I feel like care, aging doesn't, we don't just wake up one day and we're old. Like, we understand that this is coming, and yet we all, myself included at times, want to live in the state of denial and pretend like, that's not going to happen anytime too soon, but it's happening sooner than we think. So that would probably be my best answer to that question, is that people are not equipping themselves to be emotionally or logistically or financially ready for aging. And, I think that that's something that we should have big concerns about.
Right. And I wonder too, a little bit, just to follow up on this one, is how much do you think, or have you seen in your experience, has been a little bit of people not wanting to admit that mom and dad or grandpa and grandma are getting older, because that just means that everything is progressing, right? We're all on this conveyor belt, so to speak. And if you start planning and you start taking preemptive actions, that's almost admitting that you're getting closer to the end than you necessarily feel comfortable with.
I'm excited that we're having this conversation because we're entering into the season with the holidays where we're seeing our loved ones more, right? We're going to see them for Thanksgiving. Between Christmas and Thanksgiving and Christmas, we'll see them again. And what I want your audience to pay attention to is what they're really looking at, what they're really seeing, and try to venture into having those conversations, right? I don't know that we are necessarily in denial. I think that the systems are so fragmented that it's hard for us to sit down and take time and kind of go through the laundry list of communication that we probably need to with our aging loved ones, right? And again, including ourselves, right? To be prepared and equipped to have those kind of conversations. And, so I want to invite everyone to go into these holidays with their eyes open and really look at some of the signs and signals that they may be right in front of them that they're trying to ignore. But at some point, it will catch up with us. It's going to be right in our face, right? And we're going to understand. I had a situation with one of my clients recently that was a healthy couple and a reasonably healthy couple that were aging, and suddenly mom had a fall, and that kicked in this level of dementia that she could no longer be cared for in the home. She was taken out of the home. Dad was really struggling. Mom ended up passing away. And I'm telling you, Greg, it happened so quickly, this upheaval in the lives of these two people that had been married 66 years, right? That this upheaval that happened that no one saw coming. They were, leading a productive life, normal life for two people in their late 70s, early 80s. And all of a sudden, boom, it turned.
Yeah, it can happen quickly. I think that's one of the things that we really brought forward on our last conversation was to try to get out ahead of it and be proactive, learn about mom and dad's finances, learn about some of these different things that they have going on, because sometimes that also uncovers some things that moms and dads don't like to talk about with their kids. Because even though I've got all this gray hair, I'm still my mom's little boy.
Yeah, yeah,
Mom doesn't want to bother me with things that are going on with her. But with the holidays, like you said, it's a great time for us to do a check-in and really put on an honest lens when we're going through those interactions.
for sure, for sure.
Now, I did want to ask you too, in your opinion, what are some of the top 3 mistakes that you think grandparents make when it comes to stepping into that caregiving role? I brought up my mom, who's in good health. So I know mom listens to this. We're not worried. But what are some things that maybe I might be able to do that are common mistakes that you see?
Great question. I think the most prevalent mistake that is made or oversight is having responsibility without authority, right? Is that we recognize that we have a responsibility for mom or dad or both as their loving adult child, and we want to be there for them. And then we find out that we don't have the authority to make certain decisions under the legal requirements of the state we're in, right? And so I think it's really, really important. And that's the number one mistake, right? It's really important to make certain that you have the legal documentation to be able to serve your loved one well. And because depending on the state you're in, you can hit a wall really fast and furiously in that. And if you're not equipped, if you don't have all of the necessary documentation to put yourself into a place of responsibility of authority, then the authority can go to the state or to the hospital or the doctor or someone else, someone that may not have the same intention that you would have for your loved one, right? So I think that's mistake number one. Listen, I just sat on a panel, and I've got to tell you, I was a little dumbstruck by this because I've been doing this for about 18 years, right? So I thought I knew a lot. But one of the panelists was an attorney, and she was explaining the difference between a power of attorney and a durable power of attorney in the state of California. Now, I don't know that this is true everywhere, but do you know what the difference is between a power of attorney and a durable power of attorney? So the power of attorney is a document that is made available to someone that, so let's say that your parent had dementia and they can't, or they got hurt and they can't speak for themselves. The power of attorney allows you to step in and speak on their behalf. Now, if you have a parent that you have their power of attorney and they decide they're going to, go through their bank account and spend $1 million, you don't have the authority to stop them, right? But if you have power of attorney and they can't make a decision about their money for themselves, you have the authority to be able to help make that decision. The bank will recognize your power of attorney. The power of attorney, though, will die when that person dies. It stops when that individual passes, it's no longer in effect. So your power of attorney doesn't help you after death, like go in and close bank accounts and do all the other things that you may need to do in estate management, right? Durable power of attorney allows you to go in after and still have authority after the end of life, which I'm telling you, I was blown away by that. I did not realize those were the legal definitions of the two.
Wow.
Yeah.
I'm making my notes now. Wow. Any idea if there's any difference in the paperwork or what you have to do to get one versus the other?
It's really literally just having the attorney write a power of attorney or a durable power of attorney. Now, oftentimes what happens with a power of attorney is maybe the writer has written a trust, right? And they have a trust account and they have a trustee that will manage that account upon death, right? Or manage their affairs upon death based on the trust. So that can be the complementing document to the power of attorney is a trust or a trustee. But most of us probably don't have these giant estates where we need this big trust, a giant trust. And the durable power of attorney really works to move forward in making financial decisions based on the estate after death. So does that make sense?
It does. To me, it sounds like it helps to keep a person's assets out of probate and without being tied up. And again, I'm
For
not a
sure.
lawyer, so I might be getting this wrong, but that's what it sounds like to me.
Yeah. And again, I know we're working with a national audience here. I would encourage everyone that's listening to talk with your attorney, find out, at the very least, do a Google search for your state and how your state is recognizing those documents. But back to your question, responsibility without authority is just going to get you nowhere. So that's number one. The other document that I would encourage have is a HIPAA release document, right? Because depending on the care facility and then the medical facility, they may have a very narrow HIPAA rule. And listen, so much of these rules depend on the person you're talking to and their discernment of that rule, right? So if you have a HIPAA release document, which is a really simple document, you can just do it right offline and have your loved one sign a HIPAA release document, then the medical environment is required to speak with you based on that document. So that's the other document that I would encourage everyone to have. I think you should have one for your wife. I think you should have one for your mother, for your kids, everybody. In the state of California, which is where I am, at the age of 12, a juvenile becomes medically autonomous. So at the age of 12, they're now in charge of their medical record. And if you don't have a HIPAA release document on your child in the state of California, you cannot get their medical record without a release. So your child gets hurt in a car accident. You want to act on their behalf with the hospital. You don't have any ability to do that in the state of California without a medical release document because that child was independent medically at the age of 12.
That's really interesting. So, one thing I've started doing is working as a special education teacher. And some of the things that have come up have been around this in terms of some of the parents don't have full access or know what's going on with the children.
Mm-hmm.
And it's all based on, I think, very similar. And it was one of those things I'd never heard of that because as I was a dad in the 90s and things, none of that happened, really until they were 18, mom and dad could get in and know anything about that. But this is some of the new changes that have come out.
Yes.
It makes sense to have this because also too, I found out even just working with me and my wife, if you call up just for a billing dispute or anything else, sometimes those entities won't interact with you at all because of that.
Right, right. And again, every state is different. However, you're basically at the mercy of the discernment of the individual on the other end of the phone, right? And so, but if you have these documents and you're in possession of these documents, you can circumvent that pretty quickly and pretty meaningfully, right? But most of us will not pursue these documents because, again, we think, I don't really need it. But I will tell you, as a healthcare advocate, I had a young patient. She had advanced disease. We were her healthcare advocates, had been her advocates for about 3 years. The day she turned 12 years old, her files, her charts were locked down, and we could not access her charts as her advocates. Her parents could not access her charts. And we literally had to end up getting a written request by the attorney to sit down with social services at that hospital and at that facility to be able to access this child's records. And she was not able at 12, she wouldn't be able today, and she's 14, to be able to make decisions for her own medical care because her medical care is very, very advanced care, right? But it was shocking to me that at 12 years old, we were locked out. I mean, 12 is a little girl, right? 12 years old is a child. And so to give the authority for her medical decisions to her was just shocking to all of us. And what we had to go through, it took us about 3 months to be able to access that information again.
Wow. Well, now, okay, so, and I don't mean to get off on this topic, but now, so is that person before they turn 12 able to sign the documentation to allow a parent to be or a healthcare advocate to be able to see their records and help with those decisions?
Great question. What we would have done differently had we been aware was prior to the age of 12, we would have sat with her with an attorney and with a notary and had her cognitive ability established by her doctor. So we would have had her primary care doctor, an attorney, and probably a notary all sit together talking with her about what we were doing and having her sign off approval to give her parents the authority. And we ended up having to do that anyway. It was just a different process, and it was after the fact. So we were locked out of her files for a period of time until we could get that completed.
Wow,
But
that is
we had to
that's
catch her on a good day to get it done.
sure.
And again, these rules across the nation, these rules are changing very fast and furiously, and most parents have no idea that they're losing the ability to manage their children's care. And I know we're kind of veering off with the kids, but it's equally as important with our children as it is with our parents, right?
Absolutely, because I think too is one of the issues that comes up as we head into this older parent, grandparent phase is you end up with what they call the sandwich generation, right? Where
Hmm.
you may be helping and taking care of grandkids, whether it's daycare or whatever that looks
Right,
like, but then you may also be taking care of elderly parents as well.
right.
So this definitely helps anybody coming into this life.
Yeah, yeah. And I would say if you're in a state like I'm in, where they're very much kind of circling the wagon train on our youth, I would get a power of attorney for that child as well, just to make certain that I had the right legal documents to have authority over my child's well-being. So, or an
Sure.
affidavit, because California is a moving target when it comes to managing our kids, and more responsibility and authority is going to the state outside of the parents' knowledge. So I think I encourage parents to take every step that they can to secure their authority with their children.
That's great advice. And I know we've talked about the two mistakes. Was there a third one there?
I think the third one is we were talking about like meeting with our parents and having this conversation. And sometimes we avoid these conversations to keep the peace, right? Like, well, my dad doesn't like talking about money, so I don't want to upset my dad. But I think in my family, what we did was we sat down with kind of an agenda with a business meeting. And we had an agenda, and on the agenda, and everybody got the agenda before we sat down, right? And could opt out of whatever subject they wanted to opt out on the agenda. But there was no surprise. Everyone knew these are the topics and the subjects, the talking points that we're going to talk about today. And everyone came to the table agreeing to have their part of that discussion. So that's what worked for my family. My mother lived with me for the last 10 years of her life. My mother held her finances very close to the vest. It wasn't, she was of that generation where you just don't talk. There's certain things you just don't talk about, right? She was a Southern lady, and, it just wasn't talked about. And so we really needed to sit down and kind of venture into places that wasn't comfortable for her. It was kind of comfortable for the rest of us because, I mean, you can look at my bank account, Greg, anytime you want to, but my mom just wasn't about that, right? So, but because she came to the table knowing we were going to have that conversation and knowing that her voice and her opinion mattered, I think rather than kind of bombarding her with mom, like you need to come clean, like what's going on, rather than that, allowing them to have their authority and their role in making this decision, I think really changes that dynamic. So the best way to get around keeping the peace, right, is still having those hard conversations, but just doing it in a more structured way so that they're prepared emotionally. And listen, it doesn't mean that someone might say, you know what, item C, we're not going to talk about that. If they choose not to have that discussion, that's their choice. And it's hard to navigate that, but I think in most cases, if they understand, like, look, this is so that if the time comes and it's necessary, we can help you. I'm here to help you. Then most parents would be willing to kind of come clean with some of those harder subjects.
Well, that's great advice. I like the idea of having it more as a structured meeting
Mm-hmm.
because, to your point, I think we hear some of the friction that pops up where, because we're at the holidays, hey, we're sitting down to Thanksgiving dinner. And then after dinner, it's mom, how much money's in the account? What do you want to do about this? And it's a time and place. And to your point, being prepared to have those discussions.
Yeah, yeah. And again, that's just honoring their role and respecting their role as adult to adult and not, flexing our muscle because maybe they're hitting a space where they're a little bit more vulnerable. I think really saying, the time has come for us to sit down and really have some serious discussions. And here's some of the things that we want to talk about. I think really changes that dynamic for sure.
I love that. Uh, I want to move on a little bit. And so, referencing back to our previous conversation, we had brought up about how overwhelming the healthcare system can be, and that it's not just a healthcare system, it's a healthcare business system. And, the example from our last episode was talking about this program called Epic, which some people may or may not know. And so, with that, and knowing that, a lot of times doctors are spending as little as 11 minutes, 15 minutes with a patient before moving to somebody else. How would you advise us to proactively start to create a care plan for our moms and our dads, even other grandparents?
So Epic continues to be the predominant operating system for almost 99% of every clinical environment in the United States. And frankly, it's taking on and getting more and more traction around the world. So in some ways, it can be good if you're, in England and they're using an Epic system and you want to pull up your charting. That may not be such a bad thing, right? But where Epic becomes a problem is when, and we're going to continue to face this problem, is where the AI portion of Epic um, is making medical decisions on your behalf. And you're not being seen and heard by your medical provider, right? They're basically just regurgitating whatever the chat part of Epic is telling them to say to you, right? I think the best way to combat that is, again, understand your medical needs, right? Understand, and I think if you sit down as a family or with a loved one that is in your corner helping advocate for you, and you understand, like, here are some of the medical concerns that I have that I feel like I'm not being seen and heard about, and then making certain that your advocate has the right authority to be able to interface and ask these questions on your behalf, and then sit and have time with your doctor to ask very specific questions, right? And say, like, so here's an example. My mother had upper respiratory disease, congestive heart failure and COPD. And when she was reaching the very end stages of her life, the doctor came to me to make certain that I was equipped to uh, follow through and make decisions, end of life decisions for her. And what I said to him, very proudly, I have to say, is, Doctor, my mother, and I had just had the conversation with my mother where I wanted her to tell me exactly what her wishes were. And she articulated them perfectly. And I said, Doctor, I just had this conversation with my mother. And if you don't mind, I would like for you and I to have this conversation with my mother because I want to hear what she has to say to you. And she was very specific with him, just like she was with me, right? There were a lot of dynamics that happened in those moments. It was honoring her and making certain that medicine understood loud and clear what she wanted and what I was going to support her for, right? And I didn't care what Epic had to say. This is how we will proceed here, right? And let me tell you, they did everything they were asked to do, everything. And I think when you go in understanding their voice and your voice and communicating what you expect outside of whatever the machine is saying, I think you can get much better care that way. And even inviting the doctor to step away from the computer. Come over here and sit with us and talk with us. Come away from the computer. And I do that a lot. I invite doctors often to step away from the computer and come and sit with us. And when you do, sometimes they're a little taken back and sometimes they're a little surprised. But let me tell you, when they do come and sit with you, they're so happy because now they get to practice medicine. And that's what they signed up for, right? So it's just kind of helping the doctor get out of his protocol a little bit, get into the humanity side of medicine and care, and then have these conversations. And so I think, care planning is about protecting the needs and desires of the individual. And if you go at it that way, it's not about creating dissension, it's not about control, it's about protecting their needs and desires. Then you really do get a different buy-in. Does that make sense?
Does. I think doctors, healthcare professionals, like so many of us, will rely on the tools that we have. And sometimes we get tunnel vision. I know I did as a project manager and other things where it's like you're just looking at this and you don't sit down and have that conversation. And you may not uncover some of the hidden information because it's not on the spreadsheet. It's not on the forms that you've been given as a tool, but it's not as good as a person communicating with another person.
Well, doctors, they listen, we're in a very, very regulated environment with medicine, right? Doctors have procedures and protocols that is just drummed into them. And they're on a very, very short, like you said, 11 minutes, 15 minutes tops, on a very short time frame with that patient, right? If we can draw them in really quickly into the care plan of your loved one, my mother has this. These are some of the things she's struggling with. This is what we think she needs. And then have the doctor communicate based on that. And again, to support the patient, not support the system, you get a different response from the doctor. But drawing them out of their protocols is not an easy thing to do. I tell you that for sure.
No, I imagine too, a lot of people will feel that as a type of security blanket, let's say, is if you're in front of the machine and you're just raising your head over the monitor to ask questions and you're just filling in information for an AI tool at this point, even to start
Mm-hmm.
to help with diagnosis. I did want to talk to you a little bit too further about where you're seeing AI coming into medicine and especially women's health with different wearable technologies, different technologies in general. And, how do we kind of navigate using and respecting these tools, but then also to your point, I think challenging their use as a substitution for actually sitting down in front of somebody.
So I don't know if I've ever shared this with you, but I was a CEO in tech for over 20 years. Did you know that? Yeah.
Yeah, I
So
remember
I
that.
Yeah. So I love technology, right? I'm not good at it. I want to say I definitely, my kids would make fun of me, right? Like, cause they're like, Mom, but cause my kids are in their 30s and I'm stuck, back somewhere. But I love what technology can help us with, right? I believe technology is a tool to inform us. I don't believe it's not a replacement for connection. It's not a replacement for all the answers. It allows us to take data and be informed by it, right? And I have designed my own technology. I have an app that just came into the market in Sacramento this year called Scroll. And Scroll.care, for all intents and purposes, the easiest description is like Amazon for care services. So you can speak in the Scroll and say, you know, I need to manage my dad's finances. I don't know how to move forward. And Scroll starts writing a care plan to help you move forward. And not only does it write a care plan, it also will introduce you to vetted providers in your marketplace that can help you, get that task completed, right? And so, and the whole goal behind Scroll was, how do I replace myself as an expensive healthcare advocate, and how do I put advocacy in the palm of your hand, in the palm of the caregiver's hand, right? So that you can have education and be equipped and ask really, really well informed, make informed decisions and ask good questions, right? So that was the premise for having Scroll designed. I'm not a programmer, but I've spent now the last 3 years having Scroll designed and bringing it into market, and I'm very proud of it. It actually speaks 14 languages. It's important, I think, to have culturally correct care. Scroll, if you're East Indian, you can communicate in your language, and Scroll's gonna try to direct you to resources that are within your culture. And soon we're gonna have Scroll in your neighborhood. So right now we released our beta testing work in the greater Sacramento market, and we're getting ready to start scaling it across the country. But keep an eye out for it. It's called Scroll.care. And anyone can go on Scroll as a care seeker and a user. There's no charge for that. We make money by putting vetted care providers. They're really the best curated providers in your marketplace. So our goal is to elevate people out of the Google search engine and into a curated marketplace where the care seeker can find the best providers within their market that are already fully vetted and fully equipped to help serve them. So, but I like tech. I think technology is a good resource, and I think it can really, really help in monitoring data, in feeding us data as patients, as loved ones, right? But it should never replace the human to human connection, number one. And number two, it really should be used to inform us. And then to take that information and pass it to our medical doctor and say, hey, I've been wearing this wearable and this is what it's telling me every day, right? And I have a concern. And so you take that data to your medical doctor, you share the data, and then you have the appropriate testing done. But it should not replace those kind of tests. It shouldn't replace medical dialing in with your medical professional. And we'll get to the point where wearables will start speaking to your Epic, charting, and you'll be in direct connection. We're not far off from that already. So it'll get to that place, which is kind of cool, because then hopefully we can get the doctor out of their protocol and they can call up and say, hey, Greg, this keeps coming up on your wearable. I think we need to have you come in and run some blood work, right? That's the ideal situation. So I'm about tech, but we'll see where it goes.
Yeah, I think on our previous conversation, we talked a little bit about your background. And if I'm not mistaken, you were back in Menlo Park back in the
Yeah,
70s and 80s,
yeah, yeah.
and doing a lot of good work there. And you've got to be probably one of the few healthcare advocates, people in the healthcare industry, that's developing something to take away part of what you do. It seems like healthcare is just adding on and adding on and adding on. And the
Mm.
Scroll.care sounds like a great way. Well, one, for people to advocate for themselves like you talk about, but then two, be able to even further help you and your team be able to focus in on maybe some areas that you hadn't been able to focus as much attention into.
Well, and you're correct. The ideal situation, honestly, Greg, is a couple of things. First of all, I still do a lot of healthcare advocacy. My team and I, we have a full client base, but that's an expensive proposition, right? And the more fragmented and siloed healthcare becomes, and ancillary services become, the more difficult it is for people to be able to pay those kinds of monies, right? So my goal was how do I take what I know and what I understand, number one, as a healthcare advocate, and how do I deliver that to a larger mass of people and help people learn how to help themselves and help them navigate these systems, right? Number one. Number two, we hear a lot today about how people are being exploited through these systems. And how do we elevate the really, really good providers that are doing it for all the right reasons? How do we get them off that hamster wheel that they're, paying for SEO and trying to get up on the Google, on the search engines, right? How do we get them out of there and into an elite environment where they're elevated? And you and you could call me up and say, "Hey, Renee, I need a fiduciary in Sacramento. Do you have one you'd recommend?" I have, 5 of them I'd recommend. But that's because we have that relationship. How do I provide that information to the 5 fiduciaries out of the 700 of them that I would recommend, right? And so I really, part of the goal is to take those well-meaning care providers, the ancillary providers, the pet sitters, the people that are, doing in-home care, the fiduciaries, the family law attorneys, right? How do we take the really, really good ones that are doing it for the right reason, pull them up and put them in a marketplace where you can contact them directly and just go right through the app, answer a few questions, and you can reach out to them directly right through the app. And that's what Scroll is all about. I don't sell my providers, I don't auction it off, I don't go take it out to the highest bidder. I give the consumer the opportunity to know, here's the 5 best fiduciaries in Sacramento, and here's why, and here's their reviews, and here's the background work that we've done on them, and I allow the consumer to make a decision. We also have a really big segment in Scroll that's all about education. So we have masterminds where because, a big question is, well, what the heck is a fiduciary? What do I need one for, right? So we have 10-minute mastermind classes in the app where you can open up and listen to a 10-minute tutorial on a given professional and why they might be a solution provider for you. And that's, most of us are in the deep end of the pool before we know who we're swimming with, right? Like, or who we even need in the deep end of the pool. So I really wanted to equip people about the business of care, because, I've been talking about the business of care for a long time, and it's a huge multi-trillion-dollar business. And I want the consumer to understand it.
I love that, especially those little master classes, because one of the things that jumped out to me in this conversation was going back to where we had talked about, I think it was called white coat syndrome or something very similar, where and it happens to me all the time, whether it's a broken finger or whatever I've got going on. This person's got a stethoscope around their neck and they're wearing a white coat. They must know what they're talking about. And I sit there and I nod and I
Yeah,
just go with it.
yeah,
And this
yeah.
seems to really be able to help out with some of that.
Yeah, I'll tell you a personal story. So I'm obviously my husband's healthcare advocate, right? He's the worst client I have because I will sit and listen to this man tell me about this cough and this problem with his throat, until I want to kill myself, right? And then I make a doctor appointment. We go in, and the doctor doesn't want to hear from the wife, even if the wife is, the number one healthcare advocate. The doctor wants to hear from the patient, and my husband's like, "No, I just kind of have this scratchy throat." And I'm like, "Are you kidding me right now? Like, I've heard nothing but this hack in this throat for 2 weeks, and you don't want this is your moment. Like, tell him what your problem is, right?" And I swear to you, that literally happened. And the doctor said to my husband, "Do you want her to wait in the hallway?" Because my husband was dumbfounded with the stethoscope and the white coat. He didn't even know how to tell him what was going on, right? So yeah, so it's real. That is real. It's a true story. It happens to all of us, and it really is true. It really happens.
Well, and I liked in that example too that you were in there as the advocate for your husband, because a question that I've got is, for me, if I go to an appointment with my mom or with somebody else, what are some of the questions that I should either be asking or keeping my ears out for in terms of trying to be supportive, but also advocating for, the patient, let's say?
Great, great, great question. So I always encourage the family loved one, the advocate, to sit down and make certain, Mom, we're going to the doctor, we're going to ear, nose, and throat doctor this week. And here are the things that I understand that you have concerns about. Yeah, that's true. And then, I'm having a little problem hearing. And so you add that. Okay. So in the actual exam room, the doctor's going to address Mom, as they should, right? As they should, because she's the patient. And you might have written down the things that Mom wants to talk about. So she might get confused. She suddenly moves off to, doctor, how are you doing? And kind of into this whole other line of conversation. So as the advocate, the good thing to do is say, hey, Mom, remember we talked about you wanted to mention to the doctor that you're having problems hearing in your left ear, right? And then Mom's like, oh, you're right. And now you're kind of gently ushering that conversation without undermining Mom or undermining in any way, devaluing her role in her own appointment, or the doctor, by the way, but just reminding Mom that, hey, remember. And by the way, I do this as a professional healthcare advocate. I remind my patients, right, my clients. But then the doctor says, oh, then let me look at your ear. Let's talk about this. Tell me more about it, right? So you just want to kind of be the initiator of those conversations. Now, at some point, Mom might throw her hands up and say, you know what, Greg, you need to tell him because I can't even explain it. And when she does that, that's great. Then you can say, yeah, my mother and I have been talking about this and her left ear has been bothering her for a while, right? So then now the doctor is going to listen to you and is going to pay attention to what you have to say. But it's always good to go in prepared and understand and make certain that you're kind of thorough. And it's also oftentimes I'll write down, 5 things for Mom, and the doctor has a copy as well. That, these are some of the things we wanted to make certain and cover today. And then the doctor's looking right at the talking points and saying, hey, tell me about your left ear, right? So anything you can do to equip the doctor to be successful with your mom and your mom to be successful with the doctor, the better off that appointment is going to be. Unless you're the wife and the doctor says, do you want her to sit in the hall? So that really happened. Fortunately, my husband said no.
Yeah. Oh, I can tell you, well, it's anyway, I had back surgeries and some different things. And my wife was there being supportive and listening in. And then when I got home and I'm post operations and everything else, I'm like, this thing, it's hurting a lot more than I thought. And she's just goes, yes, the doctor said it was going to hurt a lot. And I was like, I didn't pick up on
I
that.
didn't catch that.
Right.
Well, and I think that's also a really, really important point with the medical appointment, right? It's important to understand and clarify the goal of a treatment plan. It's also important to understand, when am I going to notice change? Like, is it going to get worse before it gets better? Is it just going to get better? It's important to set those expectations so that way, you and your advocate understand what's going to be coming down the road, right? And then the other thing that I'm really set against or set about is asking the doctor, what if I choose not to have this plan? What if I choose not to have this treatment or this procedure? What happens? I have a 92-year-old client right now that is having chemo. I personally don't think that that's wise. My client wanted to move forward with this treatment, but to be honest with you, I think, and even the post plan and how sick they're predicting she's going to be, and trying to get these chemicals through her body, right, is just, I don't know if she's going to survive it. She's in pretty good shape at 92, but that is a tough call, right? And so I was not present when her and her son made these decisions. They hired us after the fact. And I think I would have asked questions like, what happens if we choose not to go through this treatment plan? How much time, what's the quality of her life? And how much time does she have left with this cancer without this plan? I don't believe those questions were asked. I think they just agreed with the doctor that, this is the next step in this protocol. And at a certain age, just like with our children, at a certain age, it's okay to ask the questions and say, what's the downside if I choose not to have it? And if they say, well, you're gonna live another 6 months, extra 6 months, but you're gonna live well and probably feel pretty well. And the downside is the chemo could make you really, really sick and you could be bedridden for those 6 months. I mean, I might opt not to have the chemo, right? So, but again, I don't. The important message here is to ask the question.
Yeah, no, that's great advice. Is and to your point, that's just shows that you're wanting to be an active participant in the health plan that's going forward,
Mhm.
whether you're the patient or you're acting as an advocate for a spouse or another loved one. I think the doctors
And
sometimes might be wondering, like, how come they're not asking questions? Are they not engaged or do they not care? What and that's not necessarily the case. It's just we're going in without a game plan.
yeah, yeah. And I think in today's healthcare medical environment, it's taking longer to get in front of some of these specialists, right? Once we get in front of them, it seems like everything is fast tracked. Like, we're going to get you in. We want to do this. And again, they're following their protocols, right? I think it's okay to slow down the process and just say, if I take, a couple of weeks to decide how I want to proceed, is that okay? I think doctors are relieved and they're like, of course that's okay, right? And I think people need to slow the process down a little bit. It's taking longer to get into the doctor, but once we get in there, everything seems to be on hyper speed. Once you're in the queue, you're in the queue, and I don't agree with that. I think it's okay to say, let me slow this down a little bit and make some informed decisions.
Sure. And Renee, I've had you on for a while. I know I've got more questions for you, so we might have to bring you back on and talk even more about Scroll.care. But
Thank
is
you.
there anything in particular that we haven't brought up or haven't talked about that you would like to bring up?
I will say, thank you, by the way, so much for having me on. I always really appreciate your work, and I appreciate your audience. I think that the number one thing that I want people to step away from this with is that you're in charge. You are the most important person in the exam room, in a medical room. The most important person when you're sitting with a fiduciary or an attorney or a caregiver is you. Nobody knows you better than you do, right? And your loved one who's by your side is also your best advocate. So don't allow someone to come in and because of their, credential, make you feel less than because you're not. Your instincts and your knowledge of who you are and what's important to you is literally the best educated person in the room, especially when it comes to you. And all too often, I see people abdicating their own well-being because they want to please who they believe the authority is in the room. And I really, really am trying to encourage people. That's why it's so important to empower people, right? I want them to be educated and empowered so that they know and recognize that no, I'm informed and I'm here to represent myself and care for myself. And believe me, you will get the right results when you do that. And so that's probably the number one message I'm trying to get out to people today is, you're the smartest person in the room about you. And that's just true.
I love that. And Renee, what's the best way people can get in contact with you? Maybe see if they're a good fit to have you work with them as an advocate, or just learn more because I know you got a ton of different resources out there.
I do. I do. Thank you. So I can be reached at Renee, Renee, at Scroll.care. I changed my healthcare advocacy business from Renee and Company to Scroll Case Management Services. So we have two businesses under Scroll, but it's just easier. Just reach me at Scroll.care. I do. I work with people all over the country. I have clients in New York. I have clients in New Mexico. I have clients in Arizona. So we aren't bound by state lines in helping advocate for people and assist people. I'm happy to do a consult I do free 30-minute consults. I usually go longer than that because I'm a talker, but I'm happy to provide that input to anyone that has questions. And listen, I love what I do. I'm excited about changing the way people access care. That's my mission with Scroll is we're going to change that. We're going to change the way people are accessing care services so that they can feel good about who they're working with and why they're working with them. So So, stay tuned and keep an eye out for Scroll.care because it is coming to your town soon.
That's awesome. And Renee, I'm going to go ahead and put this invitation out there. Once we get Scroll.care out there for everybody, I'd like to have you back on so you can walk us through it and talk us more about this application.
Yeah, I can't wait for you to see it. It's really, I'm being told by potential investors that it is going to change, literally change the way people are going to pursue their care services. So I'm excited about it. And there's nothing, people ask me, well, what's something similar? There's really nothing on the market that's doing this work. And I'm especially honored that we are doing multicultural care. I think that's really, really important, right? And having been a caregiver myself, I know that my mother's, Southern lady, her expectation of her care services look different than somebody else's mother's care services, right? So it's really, really important, I think, that we can offer culturally correct services and at least step into that as much as we can, right? And I like that it speaks multiple languages. I've got a young team of programmers that are just doing a fantastic job.
That's awesome. And boy, I folks go back and listen to our first conversation. Those links will be in the show notes because we dive even more into Renee's background coming up and being a tech CEO and all of that experience. And I love how you've never fully stepped away from that either.
No, no. But here's the difference. So I'm a tech, I'm now full circle, right? I've stepped back into the tech arena, but I am a healthcare advocate that understands where technology can actually help and serve. I'm not a technologist that thinks I'm going to show you how to be a healthcare advocate. So Scroll is all about teaching you advocacy and how to empower you to be your best advocate. And that was really the goal all along. Yeah, so it's cool.
No, that's awesome. And that's such a great approach to it as well.
Thank
So
you.
Renee, this has been a blast. I've loved talking with you again, and I look forward to talking with you as soon as the Scroll.care comes out and we can really dive in and you can show us and walk us through the application.
Well, thank you. And I can't wait to show it to you. You're going to love it. So
All right.
anyway, well, thank you. Thank you for having me, Greg, and take good care. Happy holidays to you. God bless you.
Thank you, you too. I really enjoyed having Renee on the Cool Grandpa podcast. It was fun to sit down and catch up with her. I especially enjoyed learning more about Scroll.care. If you're in the Northern California area, Sacramento in particular, be sure to go to your Google Play Store or the Apple Play Store and be sure to download Scroll.care. Check that out because it's not just finding a doctor or finding a healthcare professional, it's finding somebody that's going to be a great cultural fit for you, as well as somebody that has a track record and a passion for treating each and every one of you as an individual and not just another patient they're seeing that day. The other thing I want to be sure that you follow up on is check out Scroll.care, and I'll be sure to have a link for this in the show notes. Check out all the other amazing work and resources that Renee has. I've also put together just a quick down and dirty care sheet for you to download for free. No email, no nothing. Just go to my website, go to these show notes, and you can check out the primer based on the conversation with Renee so that you can start having those meaningful conversations, not only about your care service, but also the care service for those family members that might be going through a crisis or maybe just in that mode where they need some long term healthcare advice and treatments. I hope you enjoyed this conversation as much as I did. And be sure to check out those show notes, like I said, for those links. And until next time, kids, remember to stay cool.